Welcome to the Next Level Podcast. I'm your host, Scott Dickinson. Dr. Kickass, aka Mike Piekarski, joins us back on the podcast for his second time. Mike just published a brand new continuing education course, Treating the Jiu Jitsu Athlete, where he covers lots about neck and concussion injuries. So we wanted to have him back on and see what we can learn. Please enjoy. Mike, welcome to the Next Level Podcast again.
How's it going? It's been a while.
Yeah, it's good. You are the first guest ever to return to the Next Level Podcast, so it is a tremendous honor. Thank you.
Thank you.
So you are coming off 8 days post a tremendous lift for within the physical therapy profession. You created a continuing education course, seemingly by yourself. How was that lift for you?
Oh man, so that project, it was funny because I came up with the idea, I don't know, like 2 years ago, where like a lot of times people would reach out, they say, hey, I'm a physical therapist. I want to know more about, treating combat athletes. Unfortunately, there's nothing really exists out there. So I was like, I feel like I collected a whole bunch of research with just social media. So I was like, I think that'd be a cool thing for me to do. And so I started to like look into it. And then over the last year, I think I started pretty much beginning of 2022. I think that's when I started, or I actually started to collect all the data. But you can imagine, I imagine this is like what writers have to deal with, like where, I allotted a certain amount of time to work on the presentation, but then if like I need to do something else, like it kept getting pushed away, man, it is very nice to be done with it.
I believe it. I imagine there are hours and hours and hours of content. I think there were like I just checked like over 50 modules. Is that correct?
Yeah, so it's about 9 hours because I think it's like 9 hours and like 15 minutes or something like that. Because some of it is more like video lecture based where I just kind of talk, and then I have a few video demonstration where I actually demonstrate some of the things. And yeah, like I said, it was a lot of work. Hopefully I've touched on a bunch of different learning avenues, again, from visual, me talking, and then just actually demonstrating.
And when you say demonstrating, this is not like your typical MedBridge continuing education. Dr. Kickass went into the jujitsu gym and he is showing these, techniques or movements on a partner. And so
Yeah.
that for me, I was like, that immediately caught my attention as something very unique where the jujitsu world is, it's not well understood by physical therapists. And so for a PT like you to bring us into that and talk us
Yeah.
through different things, like one thing I noticed was you had showed, we were talking about getting back to the mats after a neck injury. And then you talked about like your recommendations for if they're going to go gi or no gi. So wearing the big robe or not wearing the big robe and the implications there for stressing the neck. So just different ways. And like the fact that you just went back into the gym, because it would have been easy to sit on your computer and put that in a lecture. But I thought that a lot of the value came from you being in the gym.
Yeah. Yeah. And that was, that's another thing that there was an added difficulty is I got to make sure I had a partner who would be willing. Thankfully, the gym I'm training at, V7, the professor there, Nikolai, me and him get along great. So he was happy to help, which is nice because he's also he's a judo jiu-jitsu black belt. So there's like a few times where we go through and I'm kind of demonstrating some of the different throws. And he can do them way better than me. So you get to watch me get tossed around a bit.
That's great. I'll have to look at that specific module. So when you thought about neck injuries and preventing neck injuries as you started to develop this course, what were the things that you found? What were the things that surprised you after you did, this year and a half of research?
So, again, when it comes to neck injury, let's say we have a jiu-jitsu athlete, they have a neck injury, they want to get back to sport. So there's essentially like three things they look at is one is joint specific. Can their neck do what a neck is supposed to, right? Two, we can look at sport specific movements. Is can their neck handle these very unique stressors that really only happen in contact sports? And then the third, which doesn't necessarily apply to the neck, but injuries in general, is we can look at like general movement patterns. Like, can they do some base movements that you would expect any athlete to be able to do that might not be unique to grappling? And one of the things I talk about is we talk about the rehab process going from like an acute injury, like you just hurt your neck, all the way to getting back to sport. And unfortunately, there's no like it's not like ACL where there's so much research outside of like this is what you need to be able to do to return to sport. Which, by the way, off topic, it's still baffling how bad like the traditional physical therapist is on returning to sport for ACL, considering like the mass amount of rehab out there. But we could talk about that later.
That's fired.
uh, yeah. And I think we've talked about this before, with a combat athlete, in addition to, making sure that the neck is strong, is mobile, it has to be strong, and unfortunately with rehab, I don't think rehab really looks at neck strengthening. And again, if you're a combat athlete or any type of contact athlete, it's super, super relevant. Like if you had a neck injury, like you just got neck cranked and you go to like a traditional physical therapist and they just do some scap strengthening, some stretches, like your neck is not really ready to handle the rigors of jiu-jitsu. Like someone's could be cranking on their neck, you know. So again, I think obviously you're the guy when it comes to neck strength, but it's important. Like you need to have a strong neck for jiu-jitsu, and I look in the research and I discussed like whether people realize it or not, is like your neck can actually get stronger. I know you just put out a post recently about showing the effects of neck isometric strength improving with the NecksLevel, which is super cool now that you actually have like more data for your product. But again, like the neck can get stronger, both from a strength perspective and then like a mechanotherapy perspective. Is if, let's say, someone's dealing with a muscle strain, we do low appropriate isometric or whatever concentric eccentric movements to get the injured limb back to handling what it could do before. And then that next component is, as somebody's going back to a specific sport like jiu-jitsu, how do we go back? Because it's not just like most jiu-jitsu guys are kind of dummies and they're like, okay, my neck hurts, I'll just tap early, which one, usually they don't because they have an ego. But well, what do we do? Like how, if you were a physical therapist, how do you guide them back? Like, can you give them an alternative? And that's why, again, I went in the gym, I put the gi on and I demonstrated, hey, maybe these are some movements that you need to be careful of, because I was talking with this one guy and I was like, hey man, like you come back from a neck injury, like I think training in the gi is going to be a little bit nicer because there's less neck cranks, which again in the video I demonstrate. But then he was like, well, his jiu-jitsu style is more of an inverting style. So for people who don't understand jiu-jitsu, that means essentially like you're rolling over the top of your shoulders and your neck is crunched down. And the reason why you do that is it allows you to retain your guard and you can get into different positions. So again, I demonstrate what that is to the move. So if, like, let's say, you're an average physical therapist, doesn't understand jiu-jitsu, when they're talking about something like inversion or berimbolo, like this is what they're talking about, and then I also have like a segment where I talk about some of these movement patterns where, again, like, because like if you're a jiu-jitsu athlete, like I don't treat the neck differently from a jiu-jitsu athlete from like a football player. Like the rehabbing the neck is pretty much the same. You just have to understand the demands of the sport. So then I do some videos, some isometric movement patterns of saying this is actually how I would go from, if I wanted to do some type of inversion, these are these progressions of sport specific movements that I would include.
What's so nice about the course too is like the average PT will have no idea what a berimbolo is, what inverting is. They don't even know what the common injuries after competing would be. Like what kind of injuries would they see if
Yeah.
they decided to market towards a jujitsu
Yeah.
gym? And so what you've done is you've really put together two worlds, and it's a resource where, yeah, I could imagine if I'm in the clinic, I see it, I start to see a patient, they're a jiu-jitsu athlete. Like I took this course, maybe it was 6 months ago, but now I forget some of the things. It's
Yeah.
also a resource. So I can go back to it and I can check, and it's like, oh, okay. So right, now he's starting to get back into activity. He's starting to throw around some words I don't know. Now I can refer back to this, and I can talk the talk. So I really think that's valuable, and it's also just kind of amazing to me. Kind of, it has to be like a pinch me moment. Like the entire field of physical therapy or rehab in general has never done a continuing education course on mixed martial arts or
I know.
jujitsu, and
Yeah.
you've done it.
Yeah. Yeah, and like so the reason why I broke it up into like I started with jujitsu because as I started to kind of like go through it, I was like, I got 9 hours of content without adding any type of striking. Like so and like and I do plan on doing a course with a striking athlete because there's a lot of very interesting biomechanics of like if let's say I was dealing with like a taekwondo athlete versus a Muay Thai athlete, like they have different the way that they throw a kick is going to be different. So I want to actually go into the biomechanics of it. And there's actually quite a bit of research on striking solely because like boxing has been around for a while. Jiu-jitsu obviously got a lot more popularity with UFC, but like, with boxing, there's a lot more stuff out there. Boxing, an Olympic sport, even like Taekwondo has been an Olympic sport. So I think that's why there's a little bit more out there for some of those things. But again, I'm like that course is easily going to be another 9 hours. So, and I
You're
kind of
ready.
want to break it up because I feel like 18 hours of content, like people, that's just going to be too much. So I was like, let me just make it two courses.
Yeah, and that makes sense. So I want to go back to inversions and Baron-Bolos and think through the biomechanics a bit. So maybe I'll restate it. You did. I'll restate it one more time. So an inversion is when it's almost like a headstand, but you flexed your head down so your chin is on your chest, and then
Mm.
all of your body's weight is going through your shoulders and your upper back. Would you agree with that?
Yeah, yeah,
And so it's so interesting about that position is you're required at your cervicothoracic junction primarily like max flexion, and
correct.
then so your cervical spine is going to be flexed out for sure, but all the pressure is going down on the cervicothoracic junction, and so you can imagine that position taxes the neck. And so you had talked about how that is a position to be mindful of when you are coming back from a neck injury in jiu-jitsu.
Mm.
Can you just speak a little bit more about that position, like why we would do that type of movement for the PT who might say, I don't want you to do that anymore. You're not allowed to do those.
Okay, so from a sport specific approach. So inversion, again, if let's say so for people who don't understand jiu-jitsu is, and again, I talk about this in the course, but the guard is essentially how someone can utilize their legs to control an opponent. And the reason why we do that is because legs are going to be stronger than someone's arms. So this is one of the key differences that allows a smaller opponent to defeat a bigger opponent utilizing the guard. So one of the things of jiu-jitsu, there's a concept of passing the guard. So if I'm dealing with someone, if I'm in a position where they can utilize their legs, they can have a lot of offensive capability. So I need to clear their legs or pass their guard into like what wrestling would be like a chest to chest pin, and then from there their offensive capabilities are much less available. So what inversion is one, if someone's passing the guard, if you can invert it, it allows you to stop them from clearing the leg. So it allows you to kind of get your guard back. So again, it still allows you to stay in the game a little bit longer. And then there's certain techniques. So in the gi, essentially, like you can do certain barambolos or inversions to go from being your back to then getting onto your opponent's back, which is a very advantageous position. In no gi, you can use some of these these positions where you can attack the legs. And in modern nogi jiu-jitsu, you're seeing that there's significantly more leg attacks coming out over like the last, I don't know, 10 years. So it's a useful movement that's unique to grappling that has a lot of performance benefits. Then from, as you said, if we were to describe the biomechanics, is you need to make sure you have pretty much full cervical flexion and then very good thoracic and lumbar flexion as well. So you don't actually roll over your neck. And, sometimes people will argue that ultimately that this position is going to be unsafe because if you do it wrong now, their body weight is going to press on your neck. But again, if you have the movement potential, if you do it correctly, one, you don't stay in that inverted position for that long. It's more of a transition. Two, if you do it correctly, you shouldn't put any pressure on your neck, right? Because if you roll over your shoulders, you're in and out. That being said, again, if you're coming back from a neck injury, your neck might have a smaller tolerance for how much stress it can handle. If you're coming back from a neck injury, you might have not have the mobility that you need. So if you try to bring your chin to your chest and you invert, again, you're going to roll over your neck, which is going to be the problem. So, that's why I kind of talk about what it is, why we do it. And then I have a few different, again, like exercises on how to get someone back to that. Because like I said, like there's no clear return to sport after a neck injury. So if you want someone to go back to jiu-jitsu after a neck injury, what are some movements that they can do? Because one of the things that I found is a lot of times in jiu-jitsu, you use warm-ups through solo drills. Well, solo drills are kind of boring. However, I find them very helpful for the rehabilitation standpoint because what a solo drill is for the most part, they're unique jiu-jitsu movements that you can practice a movement without someone else. And how I use that is if you're coming back from an injury, one, you can do it slow and controlled. Two, you got to make sure that you can do it without another person because when people go with rolling or which essentially live sparring, it's going to be with another person could be 100% intensity. There's going to be that level of like unpredictability. Like I don't know what that person's going to do, which is obviously a problem. And then obviously they can be going at, max speed. So it's a progression on, I got to make sure that they can do this before I clear them to roll. Cause if they can't do that in a controlled fashion, they definitely are going to get hurt if they try to roll live with somebody.
Sure. I have a patient friend who he had a cervical fusion following some ridiculous symptoms, and he's also a black belt in jiu-jitsu, and he owns his own gym. And so he has gone to only training in the gi because he's found that people pull on your head less when you're wearing the gi compared to no gi, where in no gi you'd have to maintain control of their upper body in some way by pulling on their head, whereas with the gi you might be pulling on their lapel or the collar around their shoulders. Have you thought about that? Have you heard of that kind of logic before?
Yep, and that's one of the things I actually showed because in the gi, the chokes are just easier with the lapel. Like there's just more work to do, like these no-gi variations. So, I mean, lapel chokes tend to be nicer because there's less pressure on the neck. And again, if I pull on the lapel, they're the pressure is not going on their neck. And then if we look at like stand-up grappling as well, like in wrestling, if you're doing takedowns without the gi, you're going to be more bent over. So first thing they're going to do is people are going to pull on your head and go for the front headlock because in wrestling, people are going to try to tackle your legs versus if you're in the gi, you have a little bit more judo throw options. So in judo, you're going to see people are a little bit more upright. So both from a stand-up grappling and from a ground grappling, yes, gi tends to be nicer after neck injuries.
I was at jiu-jitsu last night and we were drilling in gi, we were just drilling collar chokes. And I'm wondering if I can show this rash that I got on the left side of my neck from just repeatedly being choked and as we drilled back and forth. And you're right. Like, and I hadn't really thought about that. It is so focused, the stress around your neck with the collar versus someone's arms wrap around your neck. You can feel, I mean, you've probably felt the cavitations in your neck when someone squeezes you hard in certain positions. Whereas, right, with the gi, the collar choke, I have not experienced that. It's much more of a blood type
Mm-hmm.
of constriction. So, yeah, you're just making me think, and in both the PT brain and the
Mm-hmm.
person trying to survive out there on the
Yeah.
mats.
Yeah, it just like, I mean, unfortunately, with a lot of these no-gi chokes, they're just a little bit less clean. Now, again, like, people are still going to tap, but they're a lot of times people tap more because their neck is getting crunched and cranked more than they're actually ready to go to sleep.
Yeah, yeah. And you had actually done a post about this, which I found really interesting. I think it was pre-syncope, so before you passed out. It didn't. Am I remembering this correctly? It didn't appear that that had any problems for long-term brain health, things like that, when done correctly.
Yeah, so I actually do talk about this in the course, so we can look at short term, long term, and then what are some of the risks we're worried about. So um, for the long term, well, actually, we'll take short term. So let's say someone puts you in a choke, you either nearly go to sleep or you do go to sleep. So obviously that sounds terrible. Like, what actually happens? And this one specific study by Spelflung, so it was a questionnaire. I think there was about 4,000 subjects. But what he was looking at is like anyone who'd been put to sleep, like, is there any actual like neurological issues that occurred? And I think out of 4,000, there was like four neck injuries that weren't actually related to being put to sleep. Like, one person had a hyoid bone fracture. One person had like neck pain, but then they also think it had to do with like, they admit it had to also was related to bad posture. There was someone that had kind of like some type of exacerbation of migraines following, but then they admitted that like a lot of other things will cause these exacerbations of migraines. So, there was no one that had any symptoms that lasted like longer than a day. And usually the symptoms that they did have was just like them like being like incoordinated and kind of like in a fog. So that was that. And then there was another study. What they did is they were actually going to compare jujitsu athletes versus non-jujitsu athletes. So there was less subjects for this. I think there was only like I don't know, like maybe like a dozen or so. But what they were looking at is, did these jiu-jitsu athletes have any type of neurocognitive deficits? And actually, interestingly, one, they found that there was no deficits for these jiu-jitsu athletes. But then they think that they actually found that there was like some vascular adaptation. So the author hypothesized that potentially by doing jujitsu, that your body is like better at handling being strangled because it happens so much. The author admits they're unsure if it was because you have this ischemic preconditioning from getting choked, or if it's just based on high intensity. But it was kind of interesting.
Yeah, it is interesting. It's like going to the sauna and being better equipped for the heat of the summer.
Exactly. Yeah.
So what other things, like what was the most fun part for you for putting together this continuing education course? Like what things surprised you as you went through all of this? And it doesn't have to relate to the neck.
Yeah.
Like as you went through all this research and started to put this together.
I think so a lot of like the injury management stuff was like stuff that, like, because I've been doing physical therapy, I've been a little bit more aware of. So there was this one lecture I focused on, which was looking at like the physical demands of jujitsu. And I'm still an active competitor. So I was like, well, actually, this is relevant for me. Like, what do I need to be doing to be a successful competitor? Um, I think one of the things that's interesting with jujitsu is if you take jujitsu compared to some of the other combat sports like judo, wrestling, mixed martial arts, I would say that for the most part, jujitsu, most people are still recreational athletes. Even if you compete at the black belt level and you're a big name, for a lot of these competitions, they're still paying to compete. Like, they're not really making money doing it. So I think that's one of the things that might differentiate jujitsu versus something like judo and wrestling. Because even though those might be amateur sports, because there's the chance of getting to the Olympics, it's still a higher level of athleticism and I guess treating your sport like a job versus a lot of jiu-jitsu guys. Again, it could be because they're not making money. It could be because, Robert Drysdale describes jiu-jitsu having like that Brazilian surf culture. So like you have a lot of kind of undisciplined professional athletes. So I thought that was kind of interesting. And I think seeing that there's a lot of room for growth for like actually developing physical capacity for your athlete. But then like looking at things like what are some of the things that might show that an athlete or what's something that would make sure that an athlete can do better from a performance standpoint. I did a post on this recently talking about rolling for conditioning. So a lot of jiu-jitsu athletes feel like, well, obviously I just need to train more to get better conditioning. But look in this research, I actually have like scientific data to justify that that's not the case, that you can't just roll and expect your cardio to be good. Now, again, if I'm working with an athlete, we have to kind of make a list on what capacities that they need. So not every athlete needs to do outside conditioning. Like some might need to focus more on their strength or their muscular endurance or joint health, whatever. But if I'm working with an athlete that has poor conditioning, we can't just say train more because it shows from a like a research standpoint that that's just not good enough, right? I guess one of the ways that we can think of jujitsu is still primarily an aerobic sport. However, and the reason why it's still primarily aerobic, it would be considered aerobic with like multiple bursts of lactic or these sub-maximal lactic bursts. Because anything over 2 minutes is still primarily going to be focused on that aerobic system. However, when we're above that lactic threshold, which we usually are when we roll because someone's literally trying to strangle us, we're not necessarily getting the adaptions that we need to build our aerobic base. So there's actually an interesting article that showed that elite athletes and the recreational athletes didn't have that much of a difference between their VO2 max. But if you look at other sports like judo and wrestling, those have pretty significantly more VO2 max, which the way that I interpreted that is because judo and wrestling, they still treat their athletes like athletes. So they do like, if you're a competitive judo or wrestler, you're doing strength conditioning outside of training. Like you're doing that, but jiu-jitsu, that's not the case, and some of that also could be that, so the famous Marcelo Garcia, who's like one of the best jiu-jitsu guys ever, he's pretty, known because he doesn't do any strength and conditioning. So people like, well, Marcelo doesn't do it. I'm like, yeah, but he's an anomaly. Like you can't think just because Marcelo does it. So I think that was kind of an interesting thing that I found.
Yeah. Yeah. I guess neither did Bo Jackson. He didn't lift
Yeah,
weights either, but there will always be those outliers. Yeah.
exactly.
So there was something really interesting that came up in your lecture on concussion, and it
Mm.
was related to creatine consumption.
Mm.
Do you want to speak about the links that some researchers have found with creatine and recovery?
Sure. Yeah. So that's kind of interesting thing because the brain, even though the brain is what, like 5 pounds or whatever, I think like 20% of your body's energy supplies go to supplying your brain. So like in short, what is a concussion? Is it's this, it's this brain insult where your body's neurotransmitter are kind of altered. So generally you're going to have um, an imbalance of that. So as your energy demands increase, people's symptoms tend to get worse. So creatine is actually just an energy source which works on your phosphocreatine system. So there's some evidence that after a brain injury or a concussion, especially like an immediate, you can take a certain amount of creatine, which is actually helping your recovery. And there was a protocol that I can talk about because it was a protocol I got from the UFCPI, which is a free source. I think it's forget what the formula is. Um, it's it's based on your body weight. But essentially what you want to do, like post concussion, you want to do about anywhere between 20 and 35 grams of creatine over that first week period, which will help to get your recovery, because most people don't realize with a concussion, just because you don't have symptoms, that doesn't mean that the concussion is over. Your brain is still vulnerable. You just don't have symptoms. And I talk about that. So taking this creatine is a resource that your brain can use to hopefully speed up that recovery. Now, it might more focus on speeding up your brain recovery from symptoms, but again, the faster that we can get that brain to recover, the less chance that we have to worry about that second impact syndrome.
Right. It's just so interesting because, creatine, you have to like think about it. Well, why do people take creatine normally? It's to put on muscle. It's a way to get an advantage in the weight room. And then I
Yeah,
know they've done creatine studies for, does it improve your cognitive performance?
so
And
much out
now,
there. Yeah.
and then what'd you say?
There's just so much out there about
Yeah.
actually the cognitive benefits now.
Yeah, it's amazing. And then okay,
Yeah.
so it can also speed up potentially recovery from concussion. That's
Mm.
incredible. One of the things that I took away from your course related to concussion is that yes, symptoms might be gone after 7 days, and even in the medical profession,
Yeah.
when we hear symptoms are gone, we're like, oh, all right, pretty much good to go here. Let's stress them out. Let's put them through a tough cardiovascular strength workout. Did that bring on any symptoms? No,
No.
still no symptoms.
Yeah.
Okay, it seems like you're good to go. That's certainly the general feeling. But what you presented is that, yeah, but you might have another 21, 23 days to go while the brain is still in a vulnerable state. Is that correct?
Yeah. I could tell a story. It's a friend. He's a fit. I could talk about this because his friend talked about it in Joe Rogan. So I don't think I'm not giving anything away. My friend Chris Holdsworth, he was a professional MMA fighter. He won Ultimate Fighter. Um, I mean, thankfully he is back to training and he's a monster. But anyway, so he got a concussion in training. He went back too soon. He got a second concussion before his brain was ready. Again, I don't know how long it was. I never talked to him, but I think he like stopped training for like 3 or 4 years after the concussion. When I met him, he was resuming training. But that essentially ended his professional MMA career. And again, he had won Ultimate Fighter. He was undefeated. You can ask people who trained at Team Alpha Male, like how good Chris Holdsworth was. Like, Cody Garbrandt has said like this guy could have been a champion. You know what I mean? Like, so, you know, he was getting the better of TJ Dillashaw in training supposedly, and like TJ went off to be the
Mm.
champ. So it's kind of a shame because in his career, thankfully, I don't think he doesn't really enjoy competing from what I gather. He opened a jiu-jitsu gym, which is doing fantastic. So overall, like, his life is on a good path, but it just comes down to is, a lot of fighters, they kind of rely on their coaches and they're like, oh no, you can go back to training, just go light. Like, no, like your brain's not ready to do this,
Yeah.
And that's why what I'm hoping for is, as a healthcare professional, you start working with these combat athletes, you start to build a rapport. Even if you're not necessarily treating them for their concussion, you can at least educate them that, hey, like you're not ready to go back. And that's why I include some like a return to sport protocol that's used in that was like based on some scientific literature on, if let's say you have a concussion, how do you get back versus I want you to rest in your dark room and not doing anything, which is kind of the approach that they used to do about like I think 5 to 10 years ago, which isn't really the case anymore.
Right. Right. It also harkens back to the last NFL season. If you were paying at all attention to
Yeah.
Tai Tuivasa and his concussions, repeated concussions, and his
Yeah.
stumbling around on the field. And obviously, one game is 7 days on average from the next game in the NFL, and so it certainly highlights your point that 7 days isn't enough, even if
Yeah.
symptoms are improved.
Yeah, I think it's also scary, right? Because if you're in the NFL, like you're multi-million-dollar athlete. So sometimes you think that they'd want to like protect their investment, but then also they're like, we're making this much money, like you got to go play. So obviously every team's going to handle their things a little bit different. I assume that the NFL does have some type of concussion protocol. I don't know why they wouldn't have followed it, but anyway, obviously that's a
Yeah.
whole new controversy.
Yeah. Yeah. Well, it's interesting. And then speaking of controversies, you recently posted about a neck injury,
Mm.
which resulted in some level of paralysis in a jiu-jitsu gym. Can you talk us through what happened anatomically and just like that from a medical point of view, like the concerns that came from that?
Sure. So, well, this got a lot of attention because the guy sued and he made a lot of money. But essentially, what happened is there was this one guy, and he was a white belt, but like he was a competitive white belt. He'd been a white belt for 3 years, which is, when people think of white belt, they think of a beginner. Like there's like, I mean, there's a video of him competing in like a major, I think he competed in pans. And there's a video of him suplexing someone, which is just ironic. So yes, he's technically a white belt, but I don't know if a white belt means that he was a beginner. But anyway, so he was in the turtle position, which means he was kind of like curled up in a ball, and the instructor he was rolling with was trying to do a back take. So essentially, when your back's exposed, you want to get back control. So one of the things that the guy did is he did a roll. So he kind of did a forward roll. The guy, his name is Jack Greener. He posted his head, which normally what you should do is you should curl your head, but the guy didn't. He posted his head. So when the guy jumped, his full body weight forced him into this hyperextension rotated position. So afterwards, he had a severe neck injury. So the guy I think it was a incomplete C4 spinal injury. And obviously you're a PT, but you know that a C4 spinal injury means like, he had no function with his arms, his legs. He was on a respirator. He was on a catheter, right? Like he had pretty much no function. Following that, he also had a left vertebral artery dissection, which resulted in like a basilar stroke, which those are the super scary ones because like that can result in like the locked in syndrome, which is like my nightmare, where you've literally the only thing you can move are your eyes, but you're completely conscious. Thankfully, it was a incomplete spinal cord injury, so he was able to resume a active lifestyle. Again, I don't know over how long. I think the injury happened in 2018. So I don't know how long it took, but again, he's back to hiking and rock climbing. So then, the reason why this got a lot of attention, again, because he sued, he had an incorrect response. I think the instructor also did the technique wrong, because what you're supposed to do is you're supposed to put them in a position to facilitate them to curl their head, which he didn't. So, it's one of those things I'm not, I don't want to be an expert opinion,
Yeah.
I do think, it's one of those things like, do I think it was a freak accident? Yes. I think they both made mistakes. From a technical standpoint, I don't even really like that guard, that back take, just because I feel like it's unnecessary. Like it's cool when it looks cool when it's done right, but like there's just easier ways for me to take the back. I just wouldn't do it. So I think it's an opportunity for people to have a little bit better situational awareness, which is like, hey, like both, if you're doing a move, like you got to be careful because people can get hurt. I don't think that move is necessarily risky. Like I've never heard of anyone getting hurt with that move. However, like it only takes one case, and that's probably like literally the worst injury I've ever heard of. Because even though he's back to active life, like he's not. I don't know what lingering deficits he still has. I'm assuming he's not doing jiu-jitsu anymore. He did have like a multi-level fusion as well, and he had a stent and everything, but it's pretty scary.
It was a remarkable recovery to hear that he's rock
Right.
climbing. I mean, that
Yeah.
is That is
Yeah.
pretty profound. Okay, so back to the course. Um, what when someone's going through the course, what types of things do you think they should be like? Do you recommend like they're taking notes on this? Do you provide like lectures where they'll have like PDFs of the lectures that you went through? Like what kind of stuff will they get out of except for the videos? Like do they get other additional handouts, things like that?
No, I do have my reference list. I probably could include the PDFs. That's not a bad idea. I do have my master reference list because, um, I mean, point of what I'm doing is I go through and I look at research, but ultimately a lot of times it's the author's interpretation and then my interpretation of the
Yeah.
research. So someone might be like, well, I disagree with that. And then you kind of go through. I mean, that's really how research is. Like, did the author and did I make the correct assumption?
Right.
Because people could disagree. So I think that's obviously an important thing. Because like most things, is like you can't just solely look at like what the conclusion is. Like sometimes you have to actually go through the paper and look at the results to like see like, well, how did they come up with this conclusion? Like, do you agree with that? So I do have references. How I recommend someone do it is I recommend they kind of go from start to finish in order for the most part, because a lot of times I lay the ground, kind of like the foundation, because there are some people who are like you're relatively new to jiu-jitsu. So I kind of talk a little bit about like what jiu-jitsu is, some of the things, and then how I would apply, you know, like the kinesiology and like kind of like the study of movement to jiu-jitsu. I talk about the culture, we talk about the injuries, we talk about rehab, and then performance. So it's kind of like the way it's laid out. And then throughout that, like following a lecture, I might have some of those video demonstrations. So like when I'm on the rehab section, after you do the rehab overview, I have some of those technical considerations. How do we come back from a wrist, knee, neck injury or whatever? Because again, that makes sense. When we're talking about some of the specific jiu-jitsu injuries, like there's videos of me actually showing some things. Like, it's pretty common for people to have like a contact knee valgus injury where I kind of say like, this is how it happens. So again, I try to build the foundation from the beginning so everything else will make a little bit more sense.
Yeah, certainly, and it definitely flows nicely, and yeah, like the first few slides or lectures are all about for people who have no idea what's going on. So if you're a PT and you're concerned like, oh, I have no background in jujitsu, this was like literally made for you, so you are the perfect person to check it out. I was like, man, just knowing how many people get injured in the jujitsu gym, I was like, man, what an opportunity for private practice owners to get their clinicians some con ed on jujitsu, and then start marketing to their whoever their local clinic
Yeah.
or whoever their local gyms are. And then if you can build up a little clientele from a gym like that, talk about a referral source.
Yeah, absolutely. And and I don't go into like how you do like how you build a name with the jiu-jitsu community, but
Right.
generally for the most part, like you start to treat a jiu-jitsu athlete and you're successful, they like you, they refer, and it's a sport where many people get injured. It's becoming much more common, like especially because like you take a lot of other sports, like you're active, they're field sports. I think one of the things that makes jiu-jitsu so popular is, one, it's fun, but two, like there's a way that like, when you're not necessarily 18, you can still compete. Like, I think that's what makes the IBJF, the International Brazilian Jiu-Jitsu Federation, such a moneymaker, is because they have these masters divisions. So like you can be in your 30s and you still compete, but like if your sport was like football, like,
Yeah.
after 18, you're not really playing football anymore, you know? So it allows people to compete at these later ages. Um, so I mean, it's growing tremendously.
Yeah. Yeah. Seriously, like just to think how many gyms are popping up and a clinic owner. there's a real opportunity to get a new referral source. And, everybody talks in the jiu-jitsu gym. So everyone's going to be chatting. Oh, I'm in PT for my shoulder. Yeah. Brittany's doing a great job, blah, blah, blah. That is going to be a money maker. And so I would encourage PTs and clinic owners to definitely check out this course as a way to explore that option for sure.
I mean, and that's why I went that extra step to get continuing education, because I mean, we got to do, like, I was part of a course like 2 or 3 years ago, and we were putting some education. People like, can we get Con Ed? Because, as PTs, we have to do like 30 hours every 2 years. So it's like, it's not that much. However, like when you're working full time, like that means you have to do stuff on the weekends, which, it's rough to work, work 40 hours, go to a course on the weekend, and then you're back there, and then like there are some virtual options, but it's MedBridge. And unfortunately, I would say that MedBridge is, it's a good resource, but it's very, very basic, very, very basic. So this way, like I said, like you can learn about something which will help you as a physical therapist. It's unique knowledge, and you got to get Con Ed anyway.
Yeah. Win-win. And hopefully you can get your clinic to pay for it or reimburse you for it anyway. So,
absolutely.
That's great. So thinking of timing and when PTs should look for this course, how they can find this course. Are you going to do any promotions or things like that? And what would the best way for them to be to locate this course and sign up?
I can give you a link, and we can talk about that. I'd go to either my Instagram or my Facebook, which has a link to the course. For some promotions, I am working on some other content. So I'm planning on doing some like joint things. So if you bought, because like one of the things that I don't do is I don't necessarily show specific exercises, and some things I do, but it's more of like I'll show like specific movements. So I have another product, Kin Stretch, for jiu-jitsu. So I'm thinking about kind of linking those. So if someone buys one and they buy the other, we give a discount. I'm waiting until I get approved for ATC credit, and then I might have another promotion coming out. So I put that in, I think Sunday. So they said I should hear back between 2 or 4 weeks. So, then, people can get, if you're an ATC and you're interested, you can get credit too.
Yeah. And I certainly think it's worth the value. I mean, there's so much content there. You'll be able to refer back to it. So honestly, I just thank you for doing this for the PT, the ATC community. It's going to be an awesome resource moving forward. And I hope a lot of people check it out.
Thanks, man. I appreciate it.
Cool. Well, hey, thanks for coming back to the Next Level Podcast. And we might as well do it a third time if we've done it 2 times. So hopefully we'll talk again sometime soon.
Sounds good, man. I appreciate it.
All right. Thanks.